And a new study shows that Google searches for anxiety were the highest in the history of the search engine since the pandemic this spring. Researchers from the University of California, San Diego analyzed Google trends dating back 16 years. They found that searches for information about panic attacks and anxiety spiked following COVID-related news events from mid-March to mid-May. There were 3.4 million total searches for anxiety. That's about 375,000 more than usual. The study was published in Monday's Journal of the American Medical Association.
And it is not just anxiety, but also depression that is affecting so many people in these uncertain times.
But as CBS 2's Dhillon reports, one group is being hit especially hard.
Before the coronavirus hit last spring, Julia Nichita had felt anxiety before, but nothing quite like this.
Feeling of helplessness and uncertainty for the future.
Suddenly, the 28-year-old found it hard to sleep, without an appetite and often in tears. Nichita now worried about her family back home in Italy, her dating life on pause, and her new career helping to run a Soho art gallery up in the air.
I definitely was questioning whether I had made the right career choice, whether in the long term this is something sustainable.
But she's not the only young person feeling anxious or depressed. According to a recent survey by the Centers for Disease Control and Prevention, young adults and millennials reported some of the highest rates of mental health conditions in June. Manhattan psychologist Dr. Alexandra Straightner says she's seen an increase in young adults seeking help during this crisis, many who have never dealt with mental illness before.
They may be having families, looking to buy a home, working on establishing career. And of course, in the midst of the pandemic, that's been upended for many, many people.
Dr. Straightner says for many millennials, a pandemic during such a transformative time in their lives is extra crippling. But she says there are many things all of us can do to alleviate tension, including sticking to a routine, eating healthy, exercising, and speaking to loved ones and friends. Dr. Straightner says it's important to seek out professional help when necessary. If you're worried about the cost, there are many therapists and counselors that are willing to see clients on a sliding scale right now. There are also plenty of resources that are free for anyone in an emergency situation. To combat her own anxiousness, Nichita is seeing a counselor for the first time in her life, and she's taken up arts and crafts.
My therapist said that doing something with your hands really helps bring you into the moment. And
she's trying to adopt healthy coping mechanisms, especially if there's a second wave. In Soho, Kiran, CBS 2 News.